It is a fact that one of the most common reasons for anxiety and agitation in the dying process is due to bowel and bladder. Either they have urine retention and they can't urinate, or they feel like they can't urinate in the bed, or they have constipation down low in the rectum. They feel a need to go, but they can't articulate. They're losing the strength to push. And it's the number one cause for anxiety and agitation. And it's for both men and women, and I see it over and over and over. And if it's a urine retention, we often will place a catheter. Urine retention is often caused by lower constipation. The rectum is full of stool, and whether you're a man or woman, it's pressing onto the bladder, and the bladder then can't release, causing urine retention. And so now you have a full rectum and a full bladder, and it can cause absolute anxiety and agitation. In our booklet, The Hospice Care Plan, we have a section on bowel and bladder and how to keep the bowels clear, the bladder, when to identify urine retention, when to ask hospice to come place a catheter. And oftentimes by keeping, and they work together, if you keep the bowels clear, then urine retention doesn't happen. Urine retention doesn't happen if you keep the bowels clear. And this is where your hospice team, you have to really rely on them and keep track of that. We have a section in the medication section that shows where to keep track of the bowel and bladder so that we know what's going on, because really often it's bowel or bladder issues that are causing anxiety and agitation. So if you have that patient, they're getting restless, agitated, when did they last pee? When did they last poop? There's a reason they call me the bowel queen. It's important. And you got to rely on your hospice to get these issues addressed. So you can go to our website, the Hospice Care Plan, and get a copy of our booklet. And we have we have huge playlists, or a number of videos in our playlist about bowel and bladder managing, and why it's so important at end of life. So best of luck to you. Go to the shop page and get a copy. Thanks.